sky, but when you're under it, you are only gray.
Don't give up when you hear the music of chime bells, standing on the yellow crane tower.
You may feel alone now, but the world stands with you, united, united, proud and brave.
You will hear the chime bells, music lifts the darkness, shining on the way. Don't give up when you hear the music of chime bells, standing on the yellow crane tower. 夜走了，天亮了，天空和钟声一同醒来了。烟花在温暖的春风中飞扬。武汉，我们在等你。
Dear experts, dear colleagues, good evening. I'd like to welcome all our friends at home and abroad to attend this briefing and exchange of China's COVID-19 experience training. This pandemic has already affected over 160 countries, and the accumulated cases already exceeded 200,000 cases. At the same time, more than 8,000 people have passed away because of the disease. This disease has posed serious threat to the safety and wellness of people around the world. On the 11th of March, WHO has already declared COVID-19 as a pandemic. Dr. Tedros, Director General of WHO, said on the 18th of March that this virus has posed unprecedented threat to all of us. He also emphasized that we need to work together to fight against this common enemy, this novel coronavirus. In the face of this global pandemic, WHO raised the advice that we need to share experiences to the rest of the world. In terms of working together with the international society, China raised 5 measures, including strengthening collaborations and coordination with the World Health Organization and the international society, experience sharing with the rest of the world, supporting or dispatching medical experts to countries in need, providing medical supplies to the international society, as well as strengthening of the international scientific collaboration. Virus is the common enemy of the humankind. It has no border. China will work together with the rest of the world to try to fight against this virus and also to contribute our efforts and our wisdom so that we can build this community for the humankind. Therefore, HHRDC, together with the Primary Healthcare Foundation, work together for this sharing. We will also create an international public health management training program so as to provide trainings for the medical experts as well as hospital managers and enhance their ability to prevent and control infectious disease, to conduct epidemiology survey. At the same time, we will use the Belt and Road medical talent training program to provide this training free of charge to medical workers around the world. Over the past 3 months, thanks to our efforts, the epidemic in China has been effectively controlled, but we are still faced with a lot of challenges. On the one hand, we need to make sure that we control the imported cases and prevent it from further expansion. At the same time, we shall also summarize our experiences to try to find effective treatment for this disease and also to make our contributions to reduce death rate and increase cure rate. We hope that this platform of experience sharing, as well as the exchanges among experts at home and abroad, can help us share experience, knowledge, and ways to fight against this disease. Today, we are very happy to have with us a group of experts, renowned experts at home and abroad, to share with us their experiences. They are excellent doctors. They are also outstanding managers. They are also renowned scientists. At the same time, they are also models that we need to learn from. Ever since the epidemic, they have been working very hard at the forefront. I hope that their experience sharing can provide valuable insight for the rest of the world so that we can be successful in a weakness battle. Let me introduce the speakers. They are academician of the China Academy of Engineering, professor from Guangzhou Medical University, PhD supervisor, pulmonologist, 973 chief scientist, chairman of the National Clinical Research Center for Respiratory Disease, head of the China National COVID-19 expert team, and former chairman of the China Medical Association, Mr. Zhong Nanshan. Academician, Zhejiang University professor, PhD supervisor, expert on infectious disease, and leader for the China Artificial Liver Support, head of the National Lab for Infectious Disease, National Clinical Research Center for Infectious Disease, member of the China National COVID-19 expert team, Madam Li Lanjuan. Madam Li is a scientist. She's also a manager. She used to be head of the Zhejiang Provincial Health Commission. Number 3, academician, MD, head of the National Clinical Research Center for Obstetrics and Gynecology, head of the China Medical Women's Association, member of the China Society of Reproductive Medicine, leader of the hospital's aiding team to Wuhan, and president of Beijing University No. 3 Hospital. Madam Qiao is a famous expert on gynecology and obstetrics. She is also an excellent hospital president. Her hospital received the largest number of patients every year. Number 4, Mr. Zhu Chouwen, Vice President of Zhongshan Hospital, attached to Fudan University, MD, as well as the leader of the hospital's aiding team to Wuhan. Mr. Zhu is a young expert. He's also an excellent gastroenterologist. I think that we need to use these experts as models to continue to work out and enhance our capability. Again, a warm welcome to all our experts and a big thank you for sharing your experiences. I also want to take this opportunity to all those audiences online. I'd like to welcome all of you to this live broadcast. We will officially start our presentations. Madam Li, you're an excellent expert on infectious disease, infection control, and epidemiology. In 2003, in the fight against SARS epidemic, you have given us a lot of effective measures to effectively and rapidly control the epidemic. In this epidemic in Wuhan, you work together with other experts in the China National COVID-19 expert team to suggest a lockdown in Wuhan. This is unprecedented, a lockdown to a city of over 10 million people. But with hindsight, I think this courageous advice has given us a very good opportunity to curb the transmission of the virus. I really admire you. You're an excellent academician, scientist. You've also been working very hard. I want to take this opportunity to thank you for your hard work. Now I'd like to give you the floor. Welcome, Madam Li. I would like to thank all of you, dear experts, dear leaders. What I want to share with you today is a brief introduction of the protocol for diagnosis and treatment of COVID-19 patients. With under the leadership of the National Health Commission in China, we've been working hard to produce this protocol. This is the result of our concerted efforts. It represents the summary of the experience and lessons in our fight against this disease. I will talk about the etiological characteristics. I'll start with that. SARS-CoV-2 belongs to beta coronavirus genus. It is an enveloped positive sense single-stranded RNA virus. The natural host may be bats. It infects the respiratory epithelial cells with human ACE2 receptors. It is sensitive to heat and also lipid solvents such as ether, 75-degree ethanol, etc. In terms of the epidemiological characteristics, we find that the source of infection is mainly the COVID-19 patients as well as asymptomatic infected people. Route of transmission are, first of all, respiratory droplets and close contacts. In a relatively closed environment, for a long time, exposure to high concentrations of aerosol, there is also the possibility of aerosol transmission. As the novel coronavirus can also be isolated in feces and urine, attention should also be paid to feces and urine contaminated environment. Susceptible population, it's susceptible to all the population. The elderly and those with underlying diseases are more likely to have severe condition after infection. We've accumulated information about based on autopsy, and the autopsy result shows that there are varying degrees of solid changes in lungs. It will have damage of the deep airway and alveolar. There will be gray-white lesions and dark red bleeding. At the same time, it is a large number of sticky secretions overflowed from the alveolar and fibrous strands. These can be seen on the section. When it comes to the histologic changes, we found that there are diffuse alveolar damage of both lungs with hemorrhage, focal necrosis, and also hemorrhagic infarction of lung tissue. When it comes to clinical manifestations, based on the current epidemiology survey, we found that the incubation period can be up to 14 days, but mostly between 3 to 7 days. Clinically, fever, dry cough, and fatigue are the main symptoms. A few patients may have nasal congestion, runny nose, or diarrhea. For mild patients, they may have low fever or mild fatigue, but without pneumonia. For some children and neonates, they may not have typical symptoms. They may have some gastrointestinal symptoms such as vomiting or diarrhea, or only fatigue or shortness of breath. For severe cases, they may have hypoxemia after 1 week. Severe cases can quickly progress to ARDS, septic shock, metabolic acidosis, that is hard to correct, bleeding, coagulation dysfunction, and multi-organ failure. Some severe and critical cases may have low fever or even low fever. Therefore, we have to pay special attention to that particular aspect. In terms of clinical types, there are basically 4 types: mild, moderate, severe, and critical cases. For mild cases, they have mild symptoms. Imaging showed no signs of pneumonia. For moderate cases, usually they have respiratory symptoms and fevers, imaging evidence of pneumonia. For severe cases, for adults, usually they have a shortness of breath, over 30 breaths per minute, and then less than 93% of oxygen saturation in resting state. PaO2 and FiO2 is lower than 300 mmHg. For children, if it's severe, then they have a shortness of breath, excluding the effects of fever and crying. In resting state, oxygen saturation is less than 92%. Assisted breathing, cyanosis, or intermittent apnea. For the critical patients, they may have respiratory failure requiring mechanical ventilation. They may have shock, as well as other organ failure, which requires ICU care. So these are the symptoms, usual symptoms for critically ill patients. Laboratory tests, in the early stage, we find that the white blood cells were normal or decreased, lymphocyte count decreased. Some patients may have an elevation in liver enzymes, LDH, muscle enzymes, or myoglobin, elevated troponin were also seen in some critical patients. In most cases, C-reactive protein and ESR were elevated. In some critically ill patients, D-dimer increased. Peripheral blood lymphocytes also decreased. Severe and critical patients also have elevated inflammatory factors. These are for the general inspection. When it comes to etiological detection, we need to have the correct method. We need to seize the timing and improve the detection sensitivity. Usually we will take the sputum specimen because these are having the highest positive rate. So we have the principle of sputum must be collected to avoid false negatives or misdiagnosis. We also do nucleic acid detection in hospitals. And for certain laboratories, we will also do virus isolation culture. Serological test is also very important. Usually through this test, we can see the changes in IgM antibody and IgG antibody changes. Viral-specific IgM antibody becomes detectable around 3 to 5 days after the onset of the disease. Viral-specific IgG antibody reaches 4-fold increase during the recovery stage. We can also do joint testing of multiple types of specimens to try to enhance the accuracy of our diagnosis, but we need to pay attention to the safety protection during this process. How do we judge whether the patient is severe or critical? If possible, we can do the detection of CRP, PCT, D-dimer, total lymphocyte counts, and its subgroup IL-4, IL-6, IL-10, TNF-alpha, INF, beta, and other indicators. Inflammatory indicators reflect inflammatory and immune condition, which contributes to our judgment on the advance of the disease. Monitoring the cytokine storm is also very important. Imaging is also very important. For the high-resolution CT test, this is what we prefer, and particularly ill patients could perform back-sided X-ray examination. In the early stage, lung present multiple plaques, GGS, usually located in the lung periphery. For advanced stage patients, there might be consolidation of both lungs or multiple interstitial changes, such as ground glass shadow, as well as focally fibrotic changes of the lungs. In terms of diagnostic criteria, the 7th version of our protocol have the relevant manifestations. When it comes to epidemiological history, any one of these 4 will be very important clinical features. For example, history of travel to residents in affected areas within 14 days prior to the onset of the disease, whether there is any contact with viral RNA positive people within 14 days prior to the disease onset, whether there are any in contact with patients who have fever or respiratory symptoms from affected areas or communities confirmed cases, or whether there are any clustered cases. In terms of clinical features, any 3 clinical features will be important. For example, whether there is fever or respiratory symptoms, whether there are imaging characteristics, whether there are decreased white blood cells or decreased lymphocyte. Any two of the epidemiologic history clinical features can be classified as suspected cases. For suspected cases, we need to give them nucleic acid testing or to see, and then we'll also see their serological test result to see whether it is positive. These are all information that are very familiar to doctors in hospitals. But of course, we shall also pay attention to other information, for example, upper respiratory tract infections caused by other viruses. And for suspected cases, we can also use other techniques such as rapid antigen detection and multiple PCR nucleic acid detection. And we will focus on the key points such as the epidemiological history, chest imaging, and etiology tests. This is a very infectious disease, the COVID-19. Therefore, early detection, early reporting, early isolation, and early treatment are very important principles. We call it 4 early principles. Early detection means that patients with fever or suspicious symptoms should go to the clinic for NAT testing. Early reporting, I direct report online of suspected and confirmed patients within 2 hours. Number 3, early isolation. For suspected or confirmed cases, we need immediate isolation. Confirmed patients can be isolated together. For treatment, suspected cases need to be isolated, 1 person, 1 room. Early treatment, confirmed and suspected patients need to be transferred to designated hospitals for early treatment. Therefore, these 4 early principles are very important for us to curb the transmission of the disease. For close contacts and for patients, we also need to pay close attention to whether they have any tendency to develop into severe or critical cases. For adults, we will see whether there is progressive decline in the number of peripheral lymphocytes, whether there is a progressive increase in the level of peripheral inflammatory indicators such as CRP and IL-6, whether there is progressive increase in lactic acid concentration, and whether there are pulmonary lesion progress in a short period of time. If yes, then we need to pay special attention because they have the tendency to develop into severe and critical patients. For children, we need to see whether there is an increase in the respiratory rate, whether there are poor mental responsiveness and drowsiness, whether there is progressive increase in lactic acid concentration. And then for those under 3 months of age or children with underlying diseases, we also need to pay special attention. When it comes to the treatment strategy, we have this strategy that we call 4 antis and 2 balance. These are based on the experiences that we accumulated from treatment of H7N9 flu to COVID-19. The four NTs mean antiviral, anti-shock, anti-hypoxemia, anti-secondary infection. Two balance means the water electrolyte acid base balance as well as microecological balance. If we can follow this strategy, we can effectively curb the disease. Antiviral treatment, we emphasize early antiviral treatment. In the treatment of H7N9, we had an article which showed that with early treatment, we can reduce the number of severe and critical cases. For the time being, in our national treatment protocol, we recommend the following antiviral treatment. For example, chloroquine phosphate, abidol, lopinavir, ritonavir, alpha interferon, and ribavirin. But of course, we need to pay attention to the side effects, toxicity, and if yes, then intervene quickly. And traditional Chinese medicine should also be used properly. The second thing is anti-shock treatment. This is to prevent further organ damage and maintain effective perfusion of the body organs. We need to focus on effective liquid therapy. And we also need to have targeted therapy. Also, we need to monitor the dynamic, have a dynamic hemodynamic monitoring. The third anti is anti-hypoxemia and prevention of organ dysfunction. Hypoxemia is a very important manifestation of COVID-19 patients, and our treatment is to have a sufficient oxygen treatment. Sometimes, if necessary, we may also have intubation. And usually, organ dysfunction and hypoxemia are caused by cytokine storm. Therefore, for this anti, early treatment is very critical. If we can stick to that, then these patients can still be cured. And appropriate use of hormone, in particular for a short period of time, sometimes is also necessary. And also we can use human immunoglobulin as a supportive method. Also, artificial liver support can be of a lot of help. If you look at this chart, with the artificial liver, we can achieve detoxification and metabolism, remove the inflammatory media in H7N9 and this COVID-19 disease. we find that the use of artificial liver support can give us a lot of support. Here you see a case by which we used artificial liver support to cure H7N9. With artificial liver support, we can see that the cytokine storm dropped dramatically. And within 5 days, this patient lives were saved. Therefore, artificial liver blood purification system can help us remove inflammatory mediators and block cytokine storm. It can also help us to support the function of organs, to do volume management, and maintain the balance of electrolyte and acid-base balance. The blood purification system treatment in the 7th version of our treatment protocol is also mentioned. The blood purification system includes plasma exchange, absorption, perfusion, blood plasma filtration, etc. It can remove inflammatory factors and block the cytokine storm. In Zhejiang and Wuhan, we used this method to treat some patients. Most of the patients can see their symptoms, in particular respiratory symptoms, improved significantly. And also, there are significant improvements in the CT imaging of chest. There is a case here, male, 52 years old. It's what we call the first generation case from Wuhan to Zhejiang province. Before the treatment, there was rapid progression with elevated CRP and IL-6, oxygen concentration 70%. But with the artificial liver treatment, the clinical condition was significantly improved. Plasma CRP and IL-6 decreased to normal. CT also showed significant improvement. The lung lesions have been improved. This is another case, 74-year-old male with underlying disease such as hypertension and diabetes. Again, with the artificial liver treatment, symptoms improved significantly. Oxygen saturation significantly improved. Another anti is what we call the anti-secondary infection. Increased WBC, CRP, and IL-6 may be related to cytokine storm. Therefore, we need to pay attention to secondary infection and also pay attention to the appropriate use of antibiotic. In particular, for severe and critical cases, we need to have a proper use of the antibiotics based on the bacteriological testing result. Water electrolyte balance, I mentioned that for these are in particular important for severe and critical patients. Therefore, we need to maintain the liquid intake. We can also use a CRT or artificial liver treatment to regulate the balance of water and electrolyte. You also find that for severe and critical cases, there is this danger of imbalance of the microecological system. So in our treatment, we need to pay attention to the microecological balance. We need to have nutritional support. We can also increase the use of prebiotics or probiotics. So these are the 4 NTs and 2 balances. In our COVID-19 protocol, we have other treatments, for example, plasma treatment, plasma from recovered patients, and also immunotherapy, in particular, the tocilizumab antibody treatment. And also psychological intervention can be of great help to help our patients increase confidence in the treatment. We can also focus on stem cell-based treatment. And again, this is to alleviate the cytokine storm symptoms. Here you see one case with the artificial liver plus stem cell treatment. This is another case with stem cell treatment and artificial liver treatment. The symptoms are improved. This is to show the efficacy of TCM, traditional Chinese medicine. We think that the combination of Western medicine and TCMs can also be a very good choice. Discharging criteria and post-discharge considerations are also specified in our treatment protocol. In particular, when it comes to discharge criteria, body temperature returned to normal for more than 3 days, significant improvement in respiratory symptoms, negative in the test, two tests, and with intervals of no less than 24 hours. And also we have post-discharge considerations. Generally speaking, prognosis are good. For those elderly and with underlying diseases, they might have a poorer prognosis. But we think that this 4 NT and 2 balance strategy can effectively improve the prognosis of patients with a severe illness. I think that we need to work together to try to win the battle. Thank you very much. Thank you, Academician Li, for giving us this comprehensive introduction. Our next speaker is Academician Qiao.
Good evening. Today is a very special occasion. Well, I believe all of us are excited because today we have observed 0 increase of confirmed cases in China. And this is a highly memorable day for Wuhan. The existing suspects have achieved 0 increase. So I see myself as part of Wuhan as well. As you could see the number, so there are 80,000 confirmed cases, and it's not easy for us to achieve what we have achieved today. In January, the outbreak was very serious, and we were suffering from lack of resources, and the whole country was severely challenged. And at that time, we were called upon by the National Health Commission to come to Wuhan. And in retrospect, we could see that before January the 1st, actually the cases accounted for 18% of the total cases. So overall, Wuhan was not up to the challenge in the early days. And the Peking University, together with number 1, 2, and 3 hospitals, organized a team of 137 medical professionals to visit Wuhan, helping with the treatment of critical and severe cases. We also helped with the reorganization of the wards and also remote diagnosis. And also we were there to help with the critical and severe cases to reduce the fatality rate. So from the 1st and 2nd of February, we helped build new wards, and also we built other new wards as well. On the 19th, we saw the discharge of the first cured COVID-19 patient, and that memory was very vivid for us. It was a big test. So with that experience, I'm more confident about what we can do for pregnant women, mothers and babies, maternal health, and also the treatment of severe and critical cases, as well as the issues. So I'm here to talk about our observations. And also, according to the protocol version 7 by a commission lead just now, we know that the maternal health has been included in version 7. And the Zhongshan Hospital, together with the Hubei Maternal Health Hospital, did a lot of things. And Party Secretary of the Health Commission visited the wards and the treatment and inspected the treatment. For the issues of concern, we mainly are concerned about whether or not the hospitals can provide safe pregnancy test and inspection. And for those patients who are infected with the COVID, where they can get the treatment and what kind of things they have to do is something that we care about. So we could see that for non-infected, we have the designated delivery facilities, and there are 44 in Wuhan, and you could access that online. And that really provides relief to many pregnant women. And the pregnant women will need to understand the items they would go through and their timeline. And also, we have provided recommendations and advisories to them. And also, when they have to be inspected, they have to go to the hospitals. But some things can be delayed and postponed. They can do the self-monitoring at home. But for pregnant women of over 82 weeks, they have to go to the hospitals. So through various ways, we could provide online education to them and advisory to them as well. However, for those infected with COVID-19, we care about them as well. And these people are usually very young, and they have very good self-protection and family protection. So here is our study statistics as of February the 18th. This is not complete. However, this covers more than 6,000 obstetric hospitals, and 252 COVID infections were reported, and confirmed cases were 115. So now the fatality rate is it's about the critical case or the severe case. So it's lower than the average. So for their delivery of babies, we can work out our recommendations. And these people are usually susceptible. So due to the very special characteristics, it's really hard to manage. So if there's any suspect, they have to be transported to designated facilities or hospitals. Here, not only in Wuhan, but also in Hubei province and also in China as a whole, there are designated facilities for delivery of babies where we could provide treatment and diagnosis. And another issue that we pay attention to is that if you contract COVID-19, whether or not it can be transmitted from mother to baby, although the evidence is still limited, through analysis, we want to share what we have. So this is an article from Lancet about a study done by Zhongshan Hospital of Wuhan. In the first 9 cases, they have observed the following. As you could see, the onset, fever, respiratory features, and complications. You can see they are all more or less similar to average COVID-19 patients. However, in terms of complications, they have some special characteristics. And in terms of the delivery, the babies are all very good. In particular, 6 newborns have been tested for COVID-19, including amniotic fluid, cord blood, and breast milk, and those are negative for the virus. And these are 6 newborns that are not affected by the virus through mother to baby transmission. So here's our conclusion. So the clinical characteristics of COVID-19 in pregnant women were similar to those reported. And now there's not much evidence for mother-baby transmission. And 2 newborn babies were confirmed with COVID-19. And one had very close contact with the nanny, but the other was confirmed 36 hours after the delivery. So this raises a lot of concerns. So in the 36 hours, what happened? This is still unknown. So we are still investigating into this. And when writing the Lancet comments, I also investigated in Hubei about 50 cases, of which 20 had swab testings for the newborns, and they're all negative. So overall, at that time, there's no sufficient evidence for mother-to-baby transmission. So the new mothers or pregnant women don't have to be too concerned. And but the pregnant women and newborns are still susceptible people, and so they're still concerned about postpartum complications, and the newborns and the mothers have to be isolated for 14 days after delivery, and the breastfeeding is not recommended. And we need to observe them and monitor them, and also we should do further studies about the mother's health and the newborn's health. And many of our doctors have shared with each other the cases they have observed. And in translational pediatrics, this is one of the articles published by one of us. And Here are the results, and the swab testing is negative, but one newborn is premature, so there's still some problems. And also, there are further reports and studies regarding 16 cases with COVID-19. So here is a study between them and 45 cases without COVID-19. And the conclusion is that there's no solid evidence showing the vertical transmission from mothers to babies. No evidence. And also, we are further studying that. And right now, we have collected more than 100 cases, and we are observing them, hoping that we could share more experience with our colleagues both home and abroad. So we could see that we have to pay attention to pregnant women with chronic diseases, maternal complications, and also we would encourage them to consider gestational weeks and the adverse effects of drugs. And also, pregnant women with severe or critical COVID-19 should prefer to the termination of pregnancy, and the best choice is cesarean section. And also, there's no evidence to support the termination of pregnancy without medical. So, in terms of postpartum management and also the attention to possible transmission routes, for example, breastfeeding, we have to pay more attention. So after our discussion, we would have to do the following. For those pregnant women who are infected, labor and delivery should be managed in a designated negative pressure isolation room and managed by designated personnel with specialized infection control preparation and protective gear. And neonates born to mothers with COVID-19 should not be breastfed until the mother's period of isolation is complete. And the isolation of neonates should be done. And in some areas in China, some COVID-19 positive women could deliver healthy babies. And also we have to provide psychological intervention to the mothers and mothers-to-be. So we have to provide the psychological counseling and support, because they'll go through physiological changes and psychological changes. And 94.6% of the respondents worry about being infected, and 14.7% demand for psychological consultation, and 71% would prefer to have online consultation and counseling. But for those who have to go to the hospitals for treatment, especially the pregnant women, they have to, we have to strengthen the management. For example, reduced process for triage and diagnosis, and reduce clustering. And also we have to manage those wards and isolation areas. And also in the process of consultation, if the pregnancy is less than 28 weeks, they would be jointly treated by doctors from different disciplinaries. So it is updating consensus, guideline, and policies, hoping that more and more clinical evidence can support such recommendations or correct such recommendations. In version 7, we have the clinical characteristics, treatment, and pregnancy management of pregnant women. especially for those severe and critical cases and C-section pregnant women, and so as to avoid the risk of transmission. And at the National Health Commission level, there are now policies in place as well as guiding documents. Moving forward, we need more clinical data to more accurately describe the clinical features of pregnant women and maternal and fetal risks. And for evidence on risks in first and second trimesters that's needed, we have to study the patient's features and also the fever and collect more evidence. And also we need further studies on long-term effects on maternal and infant health, because that may have an impact on the cells, reproductive cells, but now we are lacking the evidence, and we are studying whether in the ovarian the infectious the virus is present, and so in SARS infections there's no SARS infection in ovarian. Now we need to do more research on the COVID-19 for male reproductive system. There are some reports, however, for the virus impact on the male reproductive system, and ACE2, we need more research. So all in all, the effects of COVID-19 on maternal and newborn health is described as the following. In the whole process of pregnancy, there is the possibility of complications and transmission, vertical transmission, and we can do our work based on these evidence, but we need more evidences. So this is what we have observed so far. We hope that through our joint efforts, we can work together to defeat the virus. Life is invaluable.
谢谢乔院士给我们做了一个非常精彩的报告。我想对全世界的妇产科医护人员、孕产妇本人以及他们的家属都有重要的指导意义。感谢乔院士。下面有请复旦大学附属中山医院副院长朱愁文博士给我们介绍新冠肺炎重症患者方面的管理问题。大家欢迎。
各位同道，大家晚上好。也许我也得说早上好。那么在这儿，我实际上是诚惶诚恐啊，我应邀在这么一个全球播出的会议上来谈一些自己的这种心得。这心得也不仅仅是代表我自己，但李兰娟院士、乔杰院士、钟南山院士都是我们敬仰的前辈，而且我们国家的一些诊疗方案、一些具体的国策的制定中都有他们的身影。对我相信跟我的其他的同道所带领的医疗队来说，我们就是如何不折不扣的来执行国家卫健委来执行这些院士们的这些的指示。那么对我带领这么一支医疗队进驻到武汉的工作，管理一个重症病房来说起来，我想在这方面呢谈一下我自己的一些实际的体会，但里面并不完全是涉及到一些非常的这个临床上的这种操作。我想说的是，任何要做好一件事，你必须要有所准备，就是不打无准备之仗吧。中国古话一直有，对英文来说起来也有这样的话。实际上我这句话也是借用了我协和医学院的杜宾师弟所讲的这么一句话。
I want to share with you this picture. In the center, you can see that my colleague Liu Kai is enjoying the sunset together with one patient. This is a very encouraging picture. I can tell you that the patient, who is an elderly patient, has already been recovered very well. He can walk and he can do a lot of things, eating, etc. I think that whatever we achieve is based on the hard work of all, each and every one of us. And also we are following the guidance of the government. I think the preparation is far before we entered ICU. COVID-19, we know nothing about COVID-19, but then at the same time, we have limited knowledge. We need to know about the epidemic in Wuhan and in other places. Before you do treatment, you need to know what are the resources you can mobilize. It's not just necessarily the resources in the hospital that you are stationed in. It's also about a lot of other things. I want to thank the National Health Commission for the 7 versions of the treatment protocol, which give us the guidance and the evidence for us to do practical treatment. This has also lessened our burden, because there are still a lot of things that we need to learn with the protocol. The protocol is the crystallization of all the knowledge and the wisdom of experts that has given us a lot of support and help. Also, over 40,000 medical workers and the nurses were dispatched to Wuhan and Hubei to execute these protocols. We have to focus on the professionalism, and we also need to focus on the responsibility of our health workers. We also need to trust all our health workers to make sure that we can do a good job in ICU. Everything that I talked about is important. And also we go to another province, we go to another hospital. For all of us, we definitely are under stress. This is inevitable. Therefore, we need to be fully prepared. I think that this preparation shall be done before we enter the ward. We need to have sufficient protection. We need to have our own shifts and procedures. We also have to make sure that there is a smooth and good communication. This is the prerequisite that our team members can focus wholeheartedly on the treatment. Therefore, I think that because of the good preparation, because of the good protocol accumulated based on the past experience, we have received some good result in this fight against the virus in Wuhan. As I have said, everything, all the executions of the protocol need to be based on a very strong and professional team with the concerted efforts of people from multidisciplinary background. This is also based on the strong logistics and support from the local hospitals and also from the headquarters of our hospital. Also, I want to say that China does a good job in mobilizing resources all over the country to support and help Hubei and Wuhan. This is very helpful in alleviating the burden in Wuhan. We also have a very high quality CDCs and medical institutions. I also want to say that what is also very helpful is the national level and provincial level comprehensive hospital supports. They come from all over the country to support hospitals in Wuhan. With this multidisciplinary team, we very quickly enter the battle. I think this is also based on long-term preparation. This team is very professional and capable. I think this is also based on long-term learning and the accumulation of experiences. But are we 100% well prepared? No, because there are a lot of areas that we do not know about this virus and about this disease. There are also no specific treatment for the disease. We're still making a lot of explorations to observe the clinical outcome. Therefore, in our daily work, we have to have good plan. We need to have a judgment, and we also need to do a lot of tests, not necessarily nucleic acid testing, as well as to test the result or the outcome of our treatment. If there are emergent conditions, we need to know how to handle and cope with. All this requires a very capable and professional team to make sure that we can realize our expected results. I want to say that when it comes to ICU treatment and management, we have to trust our health workers. But of course, these health workers need the support and backup of our treatment protocol. The considered efforts of all these different aspects are the prerequisite for us to be successful. I don't want to talk a lot about the specific details of our clinical practice, but I want to emphasize that we are a team with science literacy. We are professional and we are capable. Even if we're faced with this unknown disease and virus, we will try our best to try to fight against the disease and realize a satisfactory result. I'll stop here. I am really very nervous in front of so many excellent explanations. Thank you very much for your sharing. I think with your effort, Zhongshan Hospital and your team can also share your successful practical experience with more people. Thank you very much. Our next speaker is academician Zhong Nanshan. He has just finished a video conference discussion with Harvard Medical School. And now we're very happy to have academician Zhong with us.
谢谢张我们主席张教授。So I don't know whether I had not attend the other three speakers meeting, so I don't know whether I have any repetitions of my talk. Anyway, I will finish that within 20 minutes. So my talk will be perspective of the management of COVID-19 in China. Okay. So as you know, up to today, there are 137,000 people infected with all over the world. and with the mortality of 4.1%. So altogether. So I would like to mention some of the main points. First is the transmission features. So as you know, there's human-to-human strong evidence showing human-to-human transmission. There's no need to say more about this. So the first case developed symptoms in January 10th. That's the family as Australia Chinese, 6 members visit Wuhan, 5 of them, and eventually the last one is also infected. That's a human-to-human because he had not been in Wuhan. So I think the road of transmission. So of course the direct contact transmissions the main road of that. But whether they have some other transmission road, so I suppose just now Professor Qiao Jie had mentioned whether they have mother-to-child vertical transmission. No, I don't think so far. Whether they have species transmission, yes, perhaps. As you know, the respiratory road is the main transmission way, and others possible road maybe like feces and urine and contaminant materials and so on. So why I mention that? Because so both in Hong Kong and in Guangdong had these cases with the same block, and then the lower part and the upper part, the different floors, and had transmission. And that means so not only for the face-to-face transmission, but also may have some contaminated material transmission. As you know, the outbreak in Diamond Princess cruise ship, so about 1/3 of them eventually had got infected. So there's no such a big opportunity for people with face-to-face transmission, maybe via the circle, closed circle, like tube, exhaustic tube, or some others transmission. So that's the human-to-human transmission. And the very important point I would like to mention about person with without symptoms, they actually had the transmission capacity. So that's a paper and talking about Shanghai, a person in Shanghai visited Germany and attended a business meeting. And some of them had accompanied him to go there. And when he flew back to Shanghai and got symptoms, and eventually 3 days ago, was proved to be infected with COVID-19. And the other companies also get the symptoms. That's the so-called asymptomatic transmission. So that's very important for the screening. So how about the dynamic of transmission? So we usually just use the basic reproductive number, the RO. So as you know, a lot of studies showing the basic reproductive number, the RO. So it's higher than SARS, higher than MERS, even higher than seasonal influenza. That's close to 3. So 1 person infected with 3 persons. So that's quite high of that. And also the very important point is, so at the beginning of the onset of the disease, so say like the first 3 or 4 days, the virus load is pretty high. That's in nasal swab. That's a throat swab. Altogether, the highest in the first 3 or 4 days, and then a subsequent decline. And then after one week, will be going down very remarkably. So virus loads very high in the upper airway at early stage. That may means more contagious in this early stage. And that's what I would like to mention to the audience. So what for this COVID-19 infection, that's high basic reproductive number, it's close to 3. It's much higher than the others. And then higher mortality. So for the average 4%, from 0.7% to 7%. So the wide range as compared with influenza, that's 10 times or even 20 times higher than the mortality of influenza. And also, very important point is the asymptomatic virus carrier can have any infectivity. They can transmit the disease to human being. That's very important for us as a prevention strategy. So the earlier stage, the patient's onset, the higher the infectivity. So that will be very much aware for the importer, 输入者. So that's, and also a very important point is keep up unobstructed of the sewer or exhausted tube. So 下水道和通风地方都要非常注意. Okay, the second is diagnosis. I think diagnosis, I don't need to say too much about that. So diagnosis of COVID infection in suspected patients, we use double check, real-time PCR for the virus RNA and port for IgM. So the showing that the recent infection. And also very important for diagnosis, a differential diagnosis is between COVID-19 and influenza. Okay. Okay, this is the method. I'm not going to talk too much about this. And this is another quick SARS serum IgM, IgG assay kit. So this is a normal person, and this is COVID-1 infection. So the IgM assay here, IgM assay, and this is IgG assay here. So by using this two kind of check, so it's easier to get the 100% of detection. And also in this country, in our country, had developed differential diagnosis using chip-based isothermal amplification and analysis. So I'm not going to talk too much about these. Actually, you can differentiate COVID-19 infection and influenza A, B, and other virus. So one very important point is, so if we meet some importer from the newly outbreak areas, 要是从外国输入者, in few patients we have found, in few patients, they have no symptoms, but using real-time PCR is so strongly positive. So, and also serum IgM is negative. In the early stage, IgM will not showing positive. So this person will ask him to go to the appointed hotel, and he actually developed fever 3 days later. So in other words, simple use IgM or IgG test cannot be used at the moment for screening. So this is, I think it's important. In particular, at this moment, some of the countries is just in the first wave. 所以这条我觉得非常重要。screening 做一个筛查，但是我们发现呢，最近几天发现有些病人从外地来的，这从其他国家比较高发的国家来的，他没有症状但是这个PCR 是强阳性，但是呢，血清的 IgM 是阴性的，血清 IgM 在早期是不一定可能是阳性，所以这个呢是要非常注意So clinical characteristics. So this is a data we collect more than 1,000 cases in China. I'm going to not to talk too much about that. Incubation period is median 4 days, 2 to 7 days. And then I think a very important point is the symptoms of fever and cough. And about 50% are afebrile on admission. So 有50%在入院的时候并没有发烧。 发烧不是唯一最主要的金标准。所以radiology showing GGO and bilateral infiltration most common in subpleural location. So and I think laboratory findings, new lymphopenia first, the LDH, increased LDH and increased direct bilirubin. That's three very important points for the diagnosis. And the outcome, of course, in patients with comorbidity, so some other chronic disease, will be much 9 times higher than the other cases in getting to a composite endpoint. That means going to ICU or invasive ventilation or death. So how to predict critical ill patients? Our predictive model will be published soon. So that in addition to X-ray and age and whether they have hemorrhage or dyspnea or something like that. And I think the 3 laboratory indices are very important. Is leukopenia and high LDH and high direct bilirubin. So we can make a prediction and see whether this patient will have a poor outcome. So the management, we have just fewer randomized studies. So you can see just published today or yesterday by Professor Qiao Jie. And the first nationwide clinical trial have shown the Calitra is shown no effective as compared with control. So in terms of the shorten the duration of clinical improvement, as well as the significantly reduce the virus load. So no difference of that. In other words, Calitra showed no efficacy of this by this study. And at the moment, we are doing some on the way doing some control study. One is chloroquine, and the second is IL-6 receptor antibody, tocilizumab, and Lanjuan jiaolang. All right, this Chinese traditional Chinese herbs, and hydrogen oxygen mixed gas inhalation, and convalescence plasma, and remdesivir. This is on the way. So we'll get the result. We could coming out in the next 1 or 2 weeks. So this is one thing is chloroquine, and we have the close to the end of the study. And as you can see, the 3D mode chloroquine, this is act to the target of the COVID-19. That's the site is 3CL protein of the COVID-19, and the dose we use 0.5 gram day twice a day for 7 days or 10 days, and the plasma concentration is 1.13 micromoles, which is quite close to the EC50. So in other words, it will be working in this way. Some of the other countries now had tested this chloroquine, and also some traditional Chinese medicine is also available. So now available in the market, we have found that some of them is really effective, like Lanjuan jiaolang, this one. And we have shown in the laboratory showing that in cell lines, it's working it had some antivirus infection, so activity. And you can see here, so Lanjuan jiaolang is antivirus activity against COVID-19. This is electron microscopy. I'm not going to talk too much about that. And the convalescence plasma will be going up. My colleagues told me he is doing 100 patients at the moment. So we'll be end up the next week. So this is the first open study. So in first 10 patients, and showed it's really had the a good effect on the neutralization antibody before and after convalescence serum plasma infusion. And also RNA test is going all to reduce or become negative of that will be published soon. So special issues of mechanical ventilation, that's in the very serious ill patients. So you can see we as a clinician, we have made some challenge. So remain to be solved. So one is the patient present with exertional dyspnea, 就是呼吸很用劲儿 with normal respiratory rate. So 呼吸频率还是正常的 under HFNC 高流量的这个鼻导管 or 非创伤就是面罩通气。So because this can persist a long time, leading to a delay of intubation. In this kind of patient, the outcome is poor. It's not that good. So if once you have found even the respiratory rate is normal, but if the patient exists with very exertional inspiration dyspnea, so intubation have to be done earlier. The second point is, although PF ratio improves soon after intubation, but sometimes we have found this kind of patient will have some difficulty in withdrawing sedative or muscle reduction because synchronization between patient and ventilator. 病人他虽然插了管以后，这个氧合改善的很快，但是这个病人呢很难测机，为什么？他一测了镇静剂或者一测了集中剂啊，很快就不同步。所以这是一个很大的问题。So the clinical manifestation is quite different from that of SARS. So from our autopsy, we have found just, I'm not going to talk too much about that. We have found just, you can see exudative fluid filling in the alveolar, just like here, you can see. So that's one thing, the very thick mucus. So you can see when you suck out the mucus, that's very viscous mucus. So this is one thing is, so our lesson is to improve the efficacy of mechanical ventilation, early cleaning of viscous mucus in small airway remain to be solved. And probably we can use some N-acetylcysteine lavage, or even nowadays in United States, they use this Parmesan to treat the patient with cystic fibrosis. Whether it will works or not remain to be solved. So we also use the hydrogen-oxygen mixed gas to reduce airway resistance. It shows some efficacy in improve the dyspnea of patients. So lastly, I would like to mention about the China strategy in controlling further spreading. So it seems the time, or we have some expert here with Professor Li, Professor Yun, and Zheng and Gao, and announced in the 20th of January. So that there was definitely human to human transmission, and also confirmed that the medical staff have been infected. Since then, I think the government had taken a strong step to combat of the COVID-19. First is lockdown Wuhan on 23rd. Don't go to Wuhan, don't leave Wuhan. The second, real-time announcement of the number of diagnosed suspected patients every day in each city nationwide. The third is interagency mechanism launched. In other words, that's make everybody should have early prevention, early quarantine, early detection. If you have found yourself had some discomfortable, so you have to seek the doctors, and early diagnosis and early isolation. So also very important is quarantine and PCR test is imperative, is be out in close contactors. This is very important. I suppose in the United States had not been this one. I think you should do that. So this is quarantine, not quarantine. That's blocking the Wuhan city, and this you can see the result. I'm not just very briefly talking about that. That's not done Wuhan at this time, and 2 weeks later, and the number of the patient reaching the peak. This is the peak in the year, the day of 4th of February. That's just 2 weeks time, reaching the peak, and after 4 weeks or 4 weeks time, return to basic control. I think that's very effective method. Just lock down the high epidemic area, and then interagency mechanism, the full early nationwide policy will make us much better. So now, we have a prediction considering the public intervention and migration. So this is the actual number of this one. So we have validated by AI to see. It's quite close to the prediction. And if we have a 5 days earlier alert, the patients much less. If the 5 days later to announce this, we're going up to more than 170,000. So pretty high. So in this way, we need, I suppose, in the United States should have a close interagency mechanism, as have 4 early. That will be much better. Thank you very much.
Thank you, academician Zhong Nanshan, for giving us this excellent presentation in English. Now we come to questions and answers. We have 3 experts joining us from the rest of the world, and they have already prepared 10 questions. The first professor is Professor Paul Rossman, CEO of Johns Hopkins Medicine and Dean of the Medical Faculty of the Johns Hopkins University. Number 1 is Professor David Palmer, professor from the Boston University School of Public Health and Medicine. Number 3 is a GP from Australia, Tonia. In the interest of time, we're not going to get connected with the 3 experts, because before this seminar, we've already had a communication about the questions. We'll just raise the questions, and then we will ask our experts to answer the questions. John, please, could you answer question 2 and 3? These are about the treatment.
这个可能这个同传这个不行。So can you hear me now?
Yes.
Okay, right. So about the medicine. So I think just now I mentioned Calitra showed no efficacy. So actually that's from Hong Kong and some others during the outbreak of SARS. So it shows no efficacy. Maybe the dose being used is lower than in Hong Kong 70 years ago. Can you hear me? Okay, yes. Right. And the second was chloroquine. I think in some of the countries had already trying that, but I think their dose is not that high enough. So we just preferred 500 milligrams twice a day for 7 days. Now it's changed to 7 days, not 10 days. So okay. And also, I have not found any evidence, any study showing hydroxy chloroquine is showing some efficacy, and any study showing that. 羟氯喹好像我没有看到有什么研究证明它有这个用处。I just had got studies showing the chloroquine, so 氯喹. So that will be different, I think. So that's in other countries they have done some work on that. So and also now the Chinese herbs, 莲花清瘟胶囊, I suppose had moved to some other, Iraq or some other countries, because the clinical study has shown so effective in terms of reducing the symptoms and lowering the fever and some others. However, there's a tendency to shorten the virus positive test, shorten the time, but there's no significant difference in between two groups. So anyway, but it did show some improvement of the symptoms and shortening the fever and it's that. And also the convalescence plasma of this. So I think the result will be coming out very soon. So at this moment, remdesivir, I think will be a little bit late. So we will have Qiao Jie, Professor Qiao Jie, now is in doing the study in Wuhan, and as a randomized study. I suppose I expect the effect of his study. I think basically it's this kind of drugs. Thank you.
谢谢周院士。下面有请严开院士来回答第1个问题和第9个问题。
好，这个第一个问题是关于诊断问题啊，这个
Nasal swab is for testing. In China, nasopharyngeal swab NAT testing is a very important diagnostic criteria for us. If the test result is positive, then we use it as a very important evidence for confirmed cases. If it's negative for the first time, we will do it again. In particular, if this patient has epidemiological history, then we will do further testing as evidence to confirm the case. We can also do IgM and IgC testing, as is mentioned by academician Zhong. If IgM test is positive, then we can use it as evidence of confirmed case. Also, we require that at least 2 test results being negative with an interval of more than 24 hours to become the criteria for discharge. Whether there will be, and then we will have medical observation for another 14 days to see whether there will be a return to positive. We implement these protocols, and it is very important for us to control the source of infection. That's my answer for question 1. The second, question 9 is a pretty big question. We're very happy that we quickly curb the transmission of the infection. Today is a very happy day because in Wuhan, we have 0 infection, and nationwide, and in Wuhan, for the first day, we have 0 infection. This is a milestone day for us. It's really very encouraging. China has implemented a lot of powerful and strong measures. The government also has the policy of taking all those that should be taken to the hospital and treating everyone that needs to be treated. But of course, this is based on early detection of source of transmission and routes of infection. All patients need, and also for all those who have fevers, they need to go to the fever clinic. And for all those who needs to receive a test, we need to give them a test so as to confirm these patients. And then for suspected cases, we definitely need to give them isolation. These are very strong and powerful measures, and we follow these measures very strictly. Wuhan was an area seriously affected by the epidemic. The central government made a decisive decision to lock down the city so as to effectively control the transmission from Wuhan to other places in China. Although other places in China saw cases, confirmed cases, but then with all these measures and strict implementations, we see 0 new cases and new infections now. As experience that we can share with you. But of course, at the very beginning, some patients found it very hard to be admitted into hospitals. We took that very seriously because if patients cannot receive effective treatment, there is a higher tendency that they may develop into severe and critical cases, if not dying. And then if we do not do the testing, then these possible potential routes of transmission are scattered around different communities. Because in Wuhan, we see the whole household being affected and then even dying from the disease. Therefore, strict isolation as well as admitting all patients into hospitals are very important measures for us. So far, we continue to encourage people to wear masks. We avoid mass gatherings to avoid transmission. This is another very important measure. I think that the central government in China is determined to have implemented those measures and policies. For the next step, I think we need to continue to be vigilant for the possible imported cases. In particular, we see transmissions and infections in other parts of the world. Therefore, we have to keep alert to try to avoid further transmission and spread of the disease. In terms of isolation for household family members, I think that we have a pretty scientific approach in China. For the confirmed patients, they can live together. Makeshift hospital is a very good example, i.e. those mild cases, mild patients live together. However, for the suspected cases and for those who are close contacts, we need to isolate them, 1 person per room. So, for severe cases, they need to go to designated hospitals. I think that with these measures, we've already achieved some results. Also, we are grateful that dozens of thousands of medical workers from other parts of the country supported Wuhan and Hubei province. Thank you, Academician Li. Question 10 will be answered by Professor Qiao. Academician Li has already introduced what we did. This is very important. Before I came to Wuhan, my hospital, Beijing University No. 3 Hospital, is a comprehensive hospital. Madam Li mentioned that we need to have different isolation for suspected versus confirmed cases. In my hospital, our outpatient on average is 13,000 per day, emergent patients on average is 8,000 people per day. So it's a huge amount of people every day. Therefore, it's very important how we do the isolation. We have to pay special attention. We have changed some of the pathways, and we have to make sure that patients had their temperature tested before they go to the hospital. And in particular, from now on, because gradually we resumed our work, I think the next step perhaps is even more critical. So what we face now is similar to what we experienced before the Spring Festival. We have to pay attention to the epidemiological situation. We also need to pay particular attention to places like hospitals. In particular, for example, the outpatient departments. One doctor, one patient, one room. And also for suspected patients, we need to give them spaces for effective isolation. We need to give them a separate pathway or place to do the testing and treatment. This is also true for households. We need to reserve rooms and places to isolate the suspected cases. I'm sure that very soon we will see even less cases in Wuhan and around the country, but we need to continue to improve and keep the protocol and the mechanisms that we have been sticking to in the past. Thank you, Professor Qiao. President Zhu is going to answer question number 7. The question is, if there is no condition to do X-rays or CT scan, can we use ultrasound testing or other testings? If laboratories do not have the condition, can we use lactate to do the test? Well, basically, I think that CT scan is a very important way for us to do the testing. If there is no CT, we can do X-ray of the chest. If not, then we can do some ultrasound testing to see whether there are changes in the chest of the patient, although they are not as sensitive as the CT scan or X-ray. But if you want to know more about what's happening in the lung or in the chest, ultrasound is not as sensitive or effective as the CT scan or X-ray. We should also pay attention to whether there are any shocks of the patient. Also, the absolute number of lymphocytes is also important. Cardio ultrasound test can also be used. Finally, LDH in the early and late stages may not change. However, for severe and critical cases, LDH may be elevated. So we need to study further as to whether LDH can be used for advanced stage of the patient. Thank you very much. That's my answer. Thank you, President Zhu. So that's basically the end of our exchange and sharing. I want to thank the three academicians and President Zhu for their presence. I want to thank you for your sharing. You've given us valuable insight experience. I'm sure that these are very valuable to all of us. There are no borders for the virus. Now, 160 countries are hit by this virus. We need to work together all around the world to fight against COVID-19. We need to share experience of fighting this disease. Our development and the development of the world are interconnected. Thank you very much for your sharing.